Good afternoon, Chris from the Headache and Pain Management Centre here for your Monday. And today I'm from smoky Brisbane. It's actually really quite awful here today, and my best wishes to all of you in New South Wales and Queensland who might be affected. I'm thinking of you, especially those patients who are affected as well. So I just thought I'd get that out of the way right off the bat. If you are joining us, we're talking tendons today. So if you are joining us, type in below, say hello, and any questions, please ask them on the way through. Hey, I'm here from home once again today. Just come back from an appointment with Pear Hospital, actually, just talking to one of their experts about some neurological conditions, which I will release to you later on. But today we're talking tendons and tendinitises, tendinopathies, degenerative tendons, full or partial tears of tendons. These are very common as you age. It's really common to have a sore hip or a sore knee or a sore shoulder. Get an ultrasound scan and find that perhaps there is some issues with the tendon. G'day there, just seeing you join in. Say hello. Basically, when we've got these tendon type issues, one of the things that people quite frequently do is they go to their GP first, which is actually, quite the, common sense thing to do. If you've never seen a health professional before, is always the GP is the first port of call. Hey, this is what happens when you go to the GP a lot of the time when you have something wrong with the tendon. What will happen is that they'll get the scan, they'll get an ultrasound and put on your shoulder or put on your hip or your knee, and they'll find, something like I just mentioned before, like a tendinitis, a tendinopathy, degenerative changes to the tendon, or perhaps a full or partial tear of the tendon. And one thing that they might actually recommend you to do is to have a cortisone injection into the tendon. So what a cortisone injection is, for those who may not be aware of it, is it's like a steroid. Okay, so corticosteroid. So what it does is it takes inflammation away, and they actually inject it normally with a local anaesthetic, so it helps with the pain that you're getting acutely as well with that tendon. Now, here's the thing. What they now know, and this is something that was really commonplace, more so 10 to 15 years ago, but still surprisingly common now, depending on the doctor that you see, is that when you get these cortisone injections, it gives you maybe a tiny bit of relief, but then it doesn't really do much. And long term, over time, it actually shows that cortisone injections do worse over time than practically just leaving them alone. Okay, so what we need to do is something extra, something else to get these tendons all sorted out. Now, what we used to think about tendons is changing all of the time. G'day, Jane, good to see you there. So what's happening is that the tendons are changing all the time. So what happens is that you have the tendons that get degenerative, they're not working quite as well. And what a tendon is, by the way, is what joins muscle to bone. So when it joins muscle to bone, that's the tendon. The really white sort of, you see it on a chicken when you have the, roast chicken or something. It's that sort of gritty, hard, stringy type thing that happens when you have a roast chicken. You don't want to eat that bit. But it's really important to connect into your bones and connect it to the muscles. And what happens with those tendons are some changes within the tendon itself. So the difference in the way that they actually connect with each other internally, and then that can cause some sort of inflammation, swelling. And if there's some more damage, it can actually cause some, partial tears, or even in some cases worse than that. Now, what we now know about tendons is it actually needs load to make them better. And what I mean by load is they need to be strong. Okay, so even though it hurts a little bit, we've got to sort of offset the pain versus the strength. So we know that with a bit of a dodgy tendon, it can be pretty sore when you are using them. Okay, I've had one myself in my knee, and it wasn't really pleasant right back at the start when I was trying to rehab this. And what basically you need to do is to gradually work your way through it to the point of pain, but not past it. It takes a little while to actually get things happening. And as you do more and more exercises, the tendon gets stronger and stronger. The pain level goes down because it gets less and less sensitive to the movement that you're doing. And then it just gets better and better as you go. So it's actually getting strong, getting some what we call load into it, and getting some strength into it, which is the way to actually get things done. So the shoulder, what you need to do, and normally it's the supraspinatus tendon, the infraspinatus tendon, or the subscapularis tendon. So if you've had those appear on your scan, very, very common. You need to do exercises with your shoulder to get those muscles that connect to the tendons strong, and also load those tendons up really, really, carefully, but well, to get the strength that you need out of it. And with hips and knees, it's all about getting strength into your quads for your patellar tendons, and for your glutes for your hip tendons, the ones that are on the outside of your hip. Can make it feel like you can't lie on your side very well. It feels really local to touch just under the skin. It's really quite painful. So that's what you need to do to get the tendons all sorted out. You need to get them strong, you need to get them loaded up, you need to get an exercise program that's just for you to get all this happening. And in fact, there was a really big trial that was done recently here in Queensland about the gluteal tendon, the hip tendon in particular, and it's shown some magnificent results over 3 months to get people back into what they want to do. So getting back walking, getting people back even squatting, lifting, sitting for longer periods of time. In fact, we had a patient, when was that? When did she come in? It was about a year ago now, where she was used to love walking, but couldn't do it anymore because of this really awful tendon pain that she'd had for 2 to 3 years. And I'm really proud to say that she got back and did a half marathon recently, which was magnificent news for her. So not saying that's going to be you, but it's just really happy to see some of the results that sometimes can happen when you get this absolutely right. Obviously, you need to make sure that you've got all of this sorted out with your physio. You have an individual treatment plan about how this works, and making sure that you've got the full diagnosis about how this all works out. If you have got tendon pain and you want to ask a question, please feel free to type in below. Feel free to drop us a line on Messenger, and we can talk to you more about what you've tried, what you might not have tried, and to see if there's anything that we can do to assist. But the take-home message for today is tendon pain. When you've got a sore tendon, you can put a cortisone, you can put a local anaesthetic in it, and it might give you some short-term relief, but it's not going to do anything long-term. You actually need to get it strong, you need to get it moving, get it active, and desensitize those pain pathways that are really stirring that tendon up to get your movement back in motion. Very good. Hope it's been an interesting one today. Hope you found that useful. Tag anyone underneath who has got tendon pain who think might be useful having listened to me today. I'll be back with another video later in this week. I hope everyone is doing well with the fires for those that are watching. And if you are overseas, feel free to donate to the fires over here because they need all the help they can get. It's going to be astronomically bad tomorrow. So I'm hoping that everyone is okay. Thanks for joining me once again, and I'll join you again soon. Cheers. Bye for now.